Well, I decided I wanted to be a doctor when I was 3 years old, and I have no idea what that was based on or where that came from, since I had no family members that were doctors. I had had no major experience with doctors or medicine, but at 3 years old, I started telling people I wanted to be a doctor. And during my training, I had an idea in my head of what I wanted to do, that I wanted to work in some community, a neighborhood clinic, where I could be involved in the health of that community. And I didn't know where it was going to be, I didn't know where it existed, but that's what I decided was going to be my job and what I wanted to do with my life in medicine. And I had an experience during residency. I did my residency in Portland, Oregon, where I worked in an inner city clinic that took care of mostly African American and Laotian and Vietnamese people. And the doctors there, the setting there was what I had conceived of what I'd wanted to do. And I actually started interviewing for a job to work at that clinic. But in 1986, I came home to run in the Almaguer's race, and a friend took me to eat at Mercado El Rey, which used to be directly across from the Chavez site. And we went to Taco Loco for lunch. And I came out of the Mercado El Rey and looked across the street and saw the 16th Street Community Health Center. Never knew it existed. I'd grown up in Milwaukee, never knew a thing about it. And I literally walked in the front door and asked them who they were and did they need a pediatrician. And that's how I literally stumbled on the 16th Street Clinic. And I came back to interview, and I found the work they were doing in the community, and the pediatric job that they had. They already had one pediatrician, and they were looking for a second one, where we went to St. Mary's Hospital to round on babies. We took care of patients in the community, and then we also went to Children's Hospital and saw our patients in the hospital. So for me, it was the dream job. And I had found the place, which was the 16th Street Community Health Center, but literally it was by dumb luck that I stumbled on it. And I say I'm not a public health person, I'm a community health person. And that's where my focus was looking at the neighborhoods around the clinic and the patients we care for here, and looking at ways that we can make their lives better and enhance their ability to live well for themselves and their children. Well, over 34 years, there are many, many moments that stand out to me, and so picking one is sort of difficult. But I think one that really sticks in my mind that was just such a special day was I took care of a young girl who had something called camptomelic dwarfism. And she was very small, obviously, because she had dwarfism, and she had scoliosis, and she had never been able to walk. And one day she showed up to clinic with her grandmother, and she was about 10 or 11 years old at the time, and told me, "Dr. Waters, I learned to walk." And sure enough, we went out into the back parking lot, and she pulled out this walker, and she walked. It was a miracle to watch this girl who everyone was predicting would never be able to walk, was able to walk. And there's actually, in the 50th anniversary booklet that got put together, there's a picture of her and I out in the parking lot as she is showing me that she can now walk with this walker. And for me, that was just witnessing a miracle, and was one of the most special days I can remember. I think people should know that the 16th Street Community Health Center is a remarkable, remarkable place. It has been here for over 50 years. It has grown exponentially in that time. When I started in 1987, there were 40 employees and 6 providers, and now we have over 400 employees and over 50 providers. We had just one small site when I first started, and now we have multiple clinics around the community. And the focus and the mission has never changed from the day I walked in. We are here to help people, we are here to help heal people, and the staff is dedicated to the patients and their families, every patient, every day, trying to get them the best care they can have to live the best way they can. And I've always been impressed with how visionary the clinic is. Anyone from any department can come up with an idea that is going to enhance the care for the patients and their families, and people will listen to that idea, and if people think it's a good idea, they'll act on it, and we'll expand our services based on the needs of the community. And I've always been impressed that we are ever evolving in what we do to provide excellent care to the patients and families that we serve. Bike Day is a remarkable event that we started about 10 years ago. It started with, we had a medical student working here with us named Michael Waters, no relationship to me, but he was a passionate bicyclist and a passionate bike commuter. And he had worked in bike shops, and he was just all about the bike. And he became very concerned about the amount of obesity he was seeing in our patient population. And he was also struck by the fact that he would bicycle through the neighborhood and not see very many kids on bikes. And so he actually proposed the idea that if we could get more bikes in the hands of kids in the community, it could help offset or at least combat the obesity epidemic that was really hitting hard in our community and in our population. So it was a simple idea where we would collect bikes, we would tune them up, and then we would have an event in a park where we would invite children and their families to come. We also had at that event lots of education from many different organizations about basically healthy choices, healthy food, healthy ways to live, how to get better physical activity and exercise. And the bribe to get them to come to this event was to give away bikes to the kids. So the first year we had about 35 bikes we gave away. And over the years it grew till the one year we actually gave away 1,000 bikes to children in the neighborhood. And with each child we gave away a helmet, because every child should wear a helmet when they ride a bike. And we gave a lock to every child because bikes get stolen quite frequently in neighborhoods. And it's kind of a drag if you give a kid a bike and then his bike gets stolen a week later. So we gave locks. We partnered with Master Lock and got locks for the bikes. So we gave a bike, a helmet, and a lock to every kid until the supply ran out at the event. And the event was fun. It was joyful. There's nothing better than seeing a child receive a bike and the happy smile they have on their face when they realize this bike is going to be theirs. So it was a very infectious atmosphere for us who were running the event, and it was a joy to see the patients and their families come and not only receive the education that we provided, but then for the children to go home with a bike. And it's been a real beautiful community event that's simple, it was low budget, but it had a big impact on the community. Work in progress. I turned 65 a month ago. I've been at the clinic 34 years. Over half my life I've been at the clinic, and being a pediatrician at the clinic is really who I am and what I know. I do have other hobbies and other interests outside of clinic, but it took up the majority of my time and the majority of my energy. And suddenly now to not have that in my life, I'm sort of looking around and trying to figure it out. And I'm going to ride my bike quite a bit because I love riding a bike. I'm going to travel, go visit friends and family, and go to beautiful parts of the country and the world. I'm going to read a lot. I'm a voracious reader, so I love having a book going. I'm going to go to movies. I'm going to do some volunteering in the community. I'm going to spend time with my mother, who lives nearby me, and I'll have more time for that now that I'm not working. And I'm just going to try and live well according to my values and my principles, and try and enjoy myself and stay fit and stay mentally sharp and try and experience new things and go to new places. And that's what I'm looking forward to.